Hello, it's Monday. It's video time. Woohoo. Okay, today I'm doing a video on wart treatment. So common plantar warts. I get this a lot and personal experience, I had some on my fingers many years ago. My kids have had them on their feet. So I have tried many different things and I'm going to tell you what I think personally works. So, I have tried laser, didn't work. I have tried freezing them, did not work. I've tried many different things and nothing really worked until I really just became consistent. So some of those other options may work for you and that's awesome if they do, but when you're dealing with kids, some of those things can be very painful, and with children I try to make things pain-free. I'm going to do what I can so kids don't experience pain if at all possible. And so what I do for wart treatment usually does not cause any pain, which I think is lovely for children. Okay, so here are the three things I like. A nail file, important. Some tape. This is just like some surgical tape. You use whatever. Am I holding this upside down? Okay, this is my favorite stuff. It is Compound W, Compound W fast acting gel, okay? And it says on here it's maximum strength, active ingredient salicylic acid, 17%. Okay, so when you're looking for this at the store, this is really the only thing you have to buy. It's got a little screw top. It squeezes out. You see it squeezing? Lovely. And it's almost like, it's like a Neosporin tube. That's kind of what it looks like. So I like this better than the kind that you have to like paint on with a polish or something, like a polished brush, because those dry up. This works really well. So here's my recommendation. You have a wart, right? Before you go to bed at night, take some of this. I'm just going to pretend. Let's just pretend I have a wart on my thumb right here. You're going to take some of this and you're going to put this on there. You're going to let it dry. Once that dries, I like to cover it with tape. So I would take some tape like this. You can even tear it. You can keep it like that. You can wrap it around. For small fingers, you can tear it in half. Whatever. Cover it with tape, okay? Sleep with it like that. Bam. The next morning, you can take it off, wash your hands normally. It might be white. It might be a little tender. That night, take a bath, take a shower. Take your handy dandy nail file and you're going to file that wart down, okay? And it might be a little sensitive when you're doing that, but you kind of just take it and you file it down, and that's getting rid of some of the dead skin that's on top. We're trying to work our way down to the seeds of the wart, which are going to look like these little black dots. That's the part that we really want to get rid of eventually when we get down there. So you file it. If you want to, you can wash it again because there might be some skin flakes and stuff. And so just kind of washing with warm soapy water, dry it. Bam, get your handy dandy ingredients, put it on again, let it dry, tape it up. Same thing. The key to getting rid of this, honestly, which I have found from personal experience, is consistency and doing this every night. Now, if you have one that's super tender, like say one night you're just like, oh, it's too painful and it's almost like it's open a little bit, skip that night. That's okay. Skip that night and then hit it the next night, okay? But honestly, I have had some super, super stubborn warts that I've dealt with, and that method really worked well. I do have one other method. If for some reason we are so stubborn and that hasn't worked, and that has happened to me one time where the consistency hasn't worked, and that is a very, very strong prescription that I can only get done at a special compounding pharmacy in town. So that is something you would have to talk to your doctor about. But again, the key to that is it really is pain-free. It's also a medicine that comes in a tube that you apply and put tape on. So it's just a very, very potent medicine, but pain-free. At the end of the day, that's what we want in kids. I find that this works, so hopefully it helps you guys too. If you have any questions, let me know. Have a good week. Bye.